So, good afternoon, everyone. So, our case study is all about the case study of an adopted Chinese woman with bulimia nervosa. So, our table of contents is consists abstract, introduction, case, part of case, discussion, and conclusion. So, the abstract, so the case study was examine the experiences of a 22 years old Chinese woman diagnosed with bulimia nervosa and then na-adapt siya into Western family and during early childhood niya. So, the introduction is the complex relationship that exists between cultural identity, adoption, and mental health is one that needs careful investigation. So the patient description of our patient is a 23 years old Chinese woman who has hospitalized twice for bulimia nervosa. So her disorder began followed yung nag-car accident yung tatay niya. So we have here the case history of our patient. So, onset of symptoms ay a 23 years old woman developed symptoms of bulimia nervosa approximately a year and a half prior to seeking help. So, ito siya, nag-start to siya yung symptom na to is yung her father is nag-car accident. So, the initial presentation is yung following the accident, I experienced symptoms of depression, including insomnia, reduced appetite, loss of interest, suicidal thoughts, and frequent crying. So, we have here the development of bulimia symptoms. So, despite the improvement in depression, I developed a compulsive eating habits, induced vomiting, and mood instability. So, she did not display concerns about her appearance, and her BMI fluctuated between 8 and 20. So, dito siya is she was prescribed fluoxetine and then nag-seek kasi siya ng help sa Shanghai Mental Health Center. So, first hospitalization niya, na-hospitalize siya nung nag-start, nag-ano na yung bulimia nervosa niya. So, resurgence of bulimic symptoms is post-hospitalization, face challenge in her relationship with her parents and her mother, revelation about her adoption, exacerbated her struggle. So, ito siya, parang nag-ano yung symptoms niya is nalaman niya na adopted pala siya. So, yun nga, nagkaroon siya ng yung mood niya is nag-worse and then so yun nga di ba nalaman niya na adapted siya and then nagkaroon siya ng yung mood niya is parang nag-increase and then yun nagkaroon na naman siya ng bulimia nervosa, parang naglala, and then the recovery and resolution of this is I underwent individual psychotherapy initially with resistance but eventually showing progress and improving family relationships. So after a month of hospitalization, her symptoms is nag-regress na siya. So, 2 years later, so, I was completely asymptomatic. So, cultural factors. So, the circumstances surroundings I adoption appeared to be central to her bulimia. So, yun nga, 'di ba parang yung sa bakit nagkaroon siya ng bulimia is yun nga dahil sa adoption niya is nalaman niya yun. So, we have here the physical examination results. So, the focus of this case study is hindi sa physical examination results. Kasi, this case study seems to be more on the psychological and cultural aspects of eye conditions. So, rather than detailed physical examination findings. So,